The news day continues here on One News Now. I'm Riza Diaz. A new batch of Pfizer COVID-19 vaccines arrived in the country. Around 918,000 doses of Pfizer BioNTech vaccines were delivered to the Philippines earlier today. These are part of the donations by the U.S. through the World Health Organization's COVAX facility. The Philippines has so far received over 86 million doses since delivery started in February. Now, around 48 million shots have been administered nationwide, with more than 23 million people already fully vaccinated. Vaccine czar Carlito Galvez urges LGUs to closely work together and to be more creative in rolling out vaccines amid the influx of supplies. Galvez noted that although more supplies have reached our shores, there remains to be a challenge for LGUs to ramp up vaccination efforts. The vaccine czar said LGUs can scale up vaccination by looking for ways to generate greater demand among their residents and increasing the daily vaccination output in the region. Galvez also believes that mayors should initiate partnerships with different agencies and private sector to boost their inoculation drives. The Commission on Population and Development, or POPCOM, reports a significant drop in the number of births in 2020, the lowest in about 34 years. According to POPCOM, there were only some 1.5 million Filipinos born and registered in the country over the past year. Undersecretary Juan Antonio Perez attributed this to fewer marriages, women delaying pregnancies during the pandemic, and the increase in modern family planning methods. Perez projected that the slowing trend of marriages, pregnancies, and childbirths will likely continue this year. Now, in the United States, children below 12 may soon be allowed to get their COVID-19 shots. This as Pfizer and BioNTech are seeking the approval of the U.S. Food and Drug Administration for an emergency use authorization. Let's watch this Bloomberg report.
Today, Pfizer and BioNTech submitted it for emergency use authorization of their children's vaccine. And it's for kids ages 5 to 11, and it's a series of 2 smaller doses. Now, the president is set to speak this afternoon about vaccination, so hear more about the focus coming from the federal level. But let's talk to Bloomberg's Robert Langreth about health and the focus of the children's vaccine. Do we think this is going to get an all clear? Because I know many a school, many a parent is waiting very much on this.
Well, right, definitely. This is the first vaccine to be submitted to be authorized in a pediatric dose for younger kids. This is ages 5 to 11 they're talking about, so younger school kids. And there's a potential of having this on the market available by early November for school kids, and certainly a lot of parents that want it. But the FDA is definitely going to look at this vaccine data and safety very, very carefully, because young kids, while they can spread the virus, they're less likely to develop severe complications. And certainly at the same time, there's some indications that younger males, and in particular, are more likely to get this rare adverse event that's been reported, this myocarditis, this heart inflammation. So that's all going to be looked at very, very carefully to make sure that the vaccine is totally safe in young kids. And one of the things that's different is that Pfizer and BioNTech are going for a lower dose in the younger kids. They're going for 1/3 the adult and older teenage dose. So it's a much lower dose on young kids. But clearly, this is a big event, a big advisory panel that's happening towards the end of the month. The data is going to be reviewed in public again, and everyone's kind of waiting very carefully to see what that reveals.
Maybe talk to us a little bit about the hurdles, the differences in the hurdles between the children's vaccines approval and the adult vaccine approval. Presumably there are a lot of parents that are waiting for this vaccine, but there are also a lot of parents that are probably going to tread somewhat lightly as to necessarily running out to get their kids vaccinated. What kind of hurdles are there for approving the vaccine that can make those parents feel a little bit more assured in its efficacy and likely side effects being somewhat minimal?
Yeah, so they are applying for an emergency use authorization. So it's similar to the original emergency use authorizations for older people. Now, the Pfizer vaccine in adults now has a full approval because they've gotten 6 months of follow-up data, and we're able to get full approval for the adult vaccine. So this would still be an emergency authorization in younger kids. But the FDA actually made, the U.S. Food and Drug Administration actually made Pfizer and other companies go back and increase the size of their trials in the younger children in order to increase the size of the safety database. So we're talking about there are likely to be several thousand younger kids in the trials.
Merck's antiviral pills are changing the game for COVID-19 treatment. So how does it work, and is it safe and effective? Let's find out from this Bloomberg Quick Take.
This little red pill is molnupiravir, Merck's new antiviral pill. The experimental medication has been shown to reduce the risk of hospitalization or death by about half. That's according to one late-stage study of adults with mild to moderate cases. It's the promise of a drug that's easy to get and take at home that has people excited.
You can potentially have it at home, which is the thing. If you can keep people out of hospital, particularly when they are infectious, because they're infected, but you can give them something that reduces their risks by at least half. Even in those high-risk groups, it's still, thankfully, under 20% of people end up in hospital. But if you can halve that, well and good. Still means 7 out of every 100 people at risk who get infected end up in hospital.
So how does it work? By inhibiting the replication of SARS-CoV-2 through lethal mutagenesis, which is a mechanism that reproduces the virus's genetic material to make mistakes.
This is all about catching people when they have an infection and they don't have that overwhelming immune response. So you have to catch them before that point. So that testing and identification of people is really critical. And then you have to have a way of catching the people that don't respond to that medication.
A 5-day course of molnupiravir will cost $700 per patient, according to media reports. Are there side effects? Interim analysis found no increase in adverse events. Only 1.3% of participants taking molnupiravir quit the therapy due to an adverse event, compared to 3.4% in the placebo group. Still, molnupiravir will need to be assessed in a much larger group of patients to properly determine its safety. Merck plans to make 10 million treatment courses by the end of this year, with more doses slated for 2022. Finally, it won't replace vaccinations, which remains the most effective shield against COVID.
Let's now take a quick look at today's other top stories. Davao City Mayor and presidential daughter Sara Duterte has tested positive for COVID-19. Her office says the younger Duterte only has mild symptoms and will be placed under isolation. The Davao City government also advises residents or workers that came in close contact with Sara to self-monitor for symptoms and get tested. Now, for those who have yet to register for the 2022 polls, heads up, the COMELEC will resume accepting applications nationwide starting tomorrow. COMELEC offices will accept the voter registrations only on weekdays and on the last day, October 30, which is a Saturday. Schedules for registration may vary in satellite registration centers, but it will run from 8 a.m. to 5 p.m. in COMELEC offices. And in the PBA, the San Miguel Bourbon stream rolled past the TNT Tropang Giga in Game 4 of their best-of-7 series, 116-90. Fresh from absorbing their own blowout loss in Game 3, S&D bounced back tremendously to deadlock the series at 2 games apiece. 7 players reached double digits for San Miguel, led by Motao Tua with 25 points and 9 rebounds off the bench. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.